Hi everyone. In this video, we will see the anatomy of cubital fossa. Cubital fossa is a triangular depression which is present in the proximal part of front of forearm, otherwise just anterior to the elbow joint. Okay, so this is a triangular depression. So before we see the boundaries and content, you should be well aware of what are the parts of triangle in 3D so that it will be easy for you to understand the boundaries. So any triangle will be having an apex and the base. So in three-dimensional, it will be having a roof and floor. Apart from these structure, there will be two side walls. Okay, so consider this as a triangle of right cubital fossa. Okay, so this will be the midline. So here, this will be the medial boundary and this will be the lateral boundary. So now we'll see one by one what are the different boundaries of the cubital fossa. First, in the roof, okay, so this is a cubital fossa. In the roof, from superficial to deep, what are the structure we are having? We will be having the skin, superficial fascia containing certain structures that we'll see. Then there will be deep fascia. Okay, so in the superficial fascia, we'll be having usually the adipose tissue. Apart from that, in this region, there will be superficial veins and cutaneous nerves and two superficial veins, the long veins in the upper limb or the cephalic vein in the lateral aspect. Medially there will be basilic vein. Okay, basilic and cephalic vein, these two veins will be interconnected with the several vein. One of this is the median cubital vein. Okay, so usually there will be some perforating vein which connects this median cubital vein to the deeper vena comitant. So because of this perforating vein, this median cubital vein will be more stabilized. Okay, and one more thing, here you can able to see the bicipital aponeurosis which is also forming the roof. Okay, so this is the flattened tendon from the biceps muscle. Okay, it's going to the posterior subcutaneous border of ulna. Because of this bicipital aponeurosis, this vein is further more stabilized. So this median cubital vein is stabilized by means of perforator and the bicipital aponeurosis. Okay. Then apart from that, we will be having the median cutaneous nerve of forearm and the lateral cutaneous nerve of forearm, which is a continuation from the musculocutaneous nerve. Okay. So again, I'm revising what are the structures present in the roof of cubital fossa: skin, superficial fascia containing basilic, cephalic, and median cubital vein, bicipital aponeurosis, then median cutaneous nerve of forearm and median cutaneous nerve of arm. Few cubital lymph node may be present. Then after removing this superficial roof layer, we'll be having medial and lateral wall. Okay, so the medial wall is formed by this lateral border of pronata teres. Okay, this is the complete pronata teres. Its lateral border forms the medial boundary of cubital fossa. Laterally, we'll be having the brachioradialis muscle. Okay, so medially pronata teres, laterally brachioradialis. Apex is formed by meeting point of this or crossing over of this pronata teres and brachioradialis. So this will be the apex. And base is formed by the imaginary line passing from the medial to lateral epicondyle. So this completes the complete boundary. Okay, so we have seen the roof, medial wall, lateral wall, and the base. Floor, after the content, we will watch the boundaries of the floor. Then coming to the contents, from medial to lateral. Okay, whenever you are writing in the exam also, you follow the same rule. Medial to lateral, the contents are median nerve, brachial artery, tendon of biceps brachii, then the superficial branch of radial nerve. Okay, so, this radial nerve divides into superficial and deep. Superficial run over here and deep one pierces the supinator muscle and continues as a posterior interosseous nerve in the back of forearm. Okay, so To remember this, there is a mnemonic from medial to lateral, MBBS. Okay, M stands for median nerve, B brachial artery, another B biceps tendon, and S for superficial branch of radial nerve. Then coming to the floor is formed by two muscles, namely brachialis and the supinator. As you all know, brachialis is inserting into the ulnar tuberosity, so it forms the most of the medial part of the roof. Okay, sorry, floor. Okay, most of the medial part of the floor, and lateral part of the floor is formed by supinator. And coming to the clinical aspect, I have already said one of the aspect is withdrawing the blood from the median cubital vein or any intravenous injection. Okay, reason for this is this median cubital vein is more fixed because of the perforator and it lies on the bicipital aponeurosis. Okay, and another thing is here the brachial artery can be compressed against the bony surface. So during the measurement of blood pressure, we can able to hear the pulsation of the brachial artery. Thank you for watching the video. If there is any doubt in this video, you can leave in the comment section. I'm planning to post the similar concepts of clinical anatomy in this channel. If you want any particular topic in the clinical anatomy, let me know in the comment section. Thank you.